Before anesthesia, surgery was not a relief, it was torture. Every cut, every stitch, every scream was part of the cure. How did ancient patients survive the unimaginable pain? This is the story of surgery before mercy, where skill battled agony and survival hung by AA. For stitroftunter in rein sai en dice einwad chartartuia. Ancient surgery without anesthesia, how did they survive? To find answers, we begin at the dawn of medicine. Thousands of years ago, Egyptian healers, Roman medics, and Greek physicians practiced surgery using sharpened bronze tools. Their knowledge was carved into stone and inked onto papyrus, a lineage of hands-on healing. In Greece, temples to Asclepius became centers of treatment, where philosophy met practice. Roman army medics carried portable kits, practical tools for battlefield wounds and daily injuries. Without anesthesia, patients relied on courage, alcohol, and sheer endurance. Surgeons learned to work quickly, to improvise, to read the body by feel and sound. Obsidian, sharper than steel, and bronze, sturdy and reliable, formed the cutting edge of early technique. But the true test was not the tool. Was the will to endure. Every culture faced the same dilemma. Pain was inevitable, and time was unforgiving. Still, they cut to cure. From drilling holes in the skull to amputating limbs, ancient surgery was shockingly advanced and terrifyingly painful. Trepanation relieved pressure, treated fractures, and some believed released malevolent spirits. Survival is evident in healed edges on ancient skulls. Proof that patients lived through the ordeal. Amputation removed crushed or infected limbs, a race between rot and rescue. Tourniquets slowed the bleeding, speed reduced suffering and blood loss. Cautery sealed vessels. The smell of burning flesh was the price of survival. Tumors, cysts, and abscesses were pared away with practiced cuts and strong stomachs. Simple sutures, poultices, and compresses completed the ritual. Each operation was a gamble between life, death, and agony. And yet, many chose the blade, because doing nothing was worse. Without anesthesia, patients turned to wine, opium, or prayers to dull the pain. Opium eased suffering in small doses, while alcohol numbed senses, imperfect shields against the knife. Rituals and faith created focus, courage, and calm, medicine for the mind when the body screamed. Some fainted. Others were restrained by ropes or assistants, as the surgeon worked quickly to save their lives. When pain peaked, bite straps and wooden wedges protected teeth and tongue. Fumes from herbs and resins dulled senses, sanitized air, or simply masked the smell of blood. Speed was mercy. Preparation shaved seconds from suffering. Experienced hands read the tremor of a muscle, the color of blood, the breathing between screams. Every motion mattered. Every pause cost. Pain could not be banished, only outrun. Surgeons of the ancient world worked with crude instruments, sharpened obsidian, iron hooks, and heated metal rods to cauterize wounds. Bronze and later iron allowed finer cuts and repeated use. Forceps and hooks exposed tissue, found splinters, and retrieved arrows. Suturas closed wounds with flax, sinew, or hair. Anything strong and clean enough. Saws came in many forms, fine-toothed for control, larger blades for speed. Bow drills converted steady hands into steady speed. Wedges split stubborn bone when drills stalled. Heated metal rods cauterized vessels, sealed wounds, and sterilized edges. Bellows and charcoal pushed temperatures high enough for decisive burns. Styptics, like alum and vinegar, tightened tissue to slow bleeding. Boiling, smoke, and sunlight, primitive but sometimes protective. Care saved edges and reduced rust, small wins in a harsh world. Edges were renewed by hand, feel, and patience. The smell of burning flesh was the smell of survival. Survival often depended on luck and infection resistance. Honey and wine sometimes kept wounds cleaner, early antiseptics, by accident and insight. Even moldy poultices, curious as they seem, may have helped. But many died not from surgery, but from sepsis, killer no one yet understood. Healed bone tells us thousands survived trepanation. Remodeled stumps record lives lived after the saw. Communities adapted with crutches, splints, and care. Survival as a shared act. Sepsis stalked silently, days after the cutting was done. Fire and fresh cloth offered some protection. Imperfect, but better than nothing. Still, their courage paved the way for modern medicine. Lessons were carried forward, scar by scar. The price was high, the debt incalculable. Today we take anesthesia for granted, but every safe operation owes a debt to those who face the blade awake. The history of surgery is not just about healing, it is about humanity's will to survive. From pain endured to pain controlled, progress written in compassion and science. Thank you for watching. Stay curious.